Hello, Chargers. COVID-19 vaccines and vaccinations have been a hot topic over the past year. And with the most recent news of potential federal mandates, we know you likely have questions. While there is no current enforceable vaccine mandate, as the federal courts have stayed the enforcement of President Biden's mandate pending further judicial action, Briar University and others around the nation are preparing for if and when this may be enforced. Please know we will inform you immediately should the status of the enforceability of the mandate change. As such, we wanted to bring our in-house experts to you to share some general information to help make decisions that are best for you and those around you. However, it is important to always consult with your physician before making medical decisions when warranted. Today, I have three Briar experts with me. Dr. Daniel Jung, PhD, Associate Professor of Biology and member of the University Response Team. Dr. Anasara Henry, DNP, ARNP, AGP, CNP-BC, PMHNP-BC, Assistant Professor of Nursing and Faculty Senate Chair. Anasara, I think you have more letters behind your name than I do. And we also have RJ Harris, Student Government President and future medical professional. So thank you to the three of you for assisting with this important topic, and thank you to those who are tuning in to learn more. So let's get started. Dr. Jung, can you tell us why the COVID vaccines are recommended?
I think it's not just for ourselves and for the community. It is important to have the vaccinations, so we cannot really spread the COVID viruses to the others anyway. And it is relatively safe, and a lot of safety data has been generated. So it is very safe to be administered. And most important thing is we are educating our immune responses in our body, because the immune system is learning processes. And since they are learning from the attenuated viruses or component of viruses, so our immune system will be able to eradicate once the virus gets into our system. And if we eradicate those viruses from our system, we're not going to be able to spread to the others. That's a main point, I think.
Great, thank you. So I know that some people still get COVID, even though they're vaccinated. Number one, why does that happen? And number two, does it provide any benefit if you're vaccinated and you then get COVID?
Okay, even though you are infected with COVID viruses and you can get reinfected, there is a reason why is that. And the first, it's because of the spike protein of the COVID viruses. That spike protein is trimer, which means it looks like this, the three fingers like that. Each protein is generated from the one mRNA, but they are making this the trimer like that. And if you are naturally infected, you may generate the antibody just for that side alone. And so if that's the case, once the other virus comes in and this antibody, that virus make a little mutation on there and this antibody cannot bind there, then we cannot really get rid of this. We cannot really protect ourselves from there. But if you are vaccinated, then we are generating multiple the antibodies that can bind many other different places. So vaccination, even because of that, CDC recommended based on that data, okay, even though you are infected, there is a chance for reinfection. But if you are the vaccinated, that chance gets lesser. So let's get vaccinated. That's how it was derived from that decisions.
Perfect, thank you. Okay, we're going to shift just a little bit. Dr. Henry, could you share with our listeners the differences between the vaccines that are available to us and any potential side effects or precautions that people need to take if they're getting the vaccine?
Yeah, absolutely. So first, in the United States, there are 3 commercially available vaccines. These are commonly known by their manufacturers. So this is going to be Pfizer, Moderna, as well as Johnson & Johnson. The differences between these vaccines are both how they are produced as well as how they work directly in the body. The first two, both Pfizer as well as Moderna, are considered mRNA or messenger ribonucleic acid vaccines, just as Dr. Jung had mentioned. These vaccines work by instilling a small piece of genetic code into our body, which is then used within our body cells to create that spike protein. The spike protein then initiates an immune response, allowing our body to recognize it and to defeat this virus. Johnson & Johnson, however, is an older technology. It's considered a vector vaccine. And this vaccine uses a small, attenuated or weakened piece of the virus. It's actually the spike protein, and it's introduced directly into the body, which then spurs on that immune response. Yeah, as far as side effects, I think they can be broken down into two general categories. So first, you have very generalized side effects that are associated with any type of injection. So this is pain, redness, swelling at an injection site. The second set of general side effects are associated with any vaccine that is boosting an immune response. So this is things like fever, fatigue, myalgia, possibly nausea, vomiting. Anytime that we're spurring on our immune response, because this is the way that our body naturally rids ourselves of viral infections. A second, more serious set of side effects are considered adverse reactions. These are much more rare, and they are something just to keep in mind. The first thing is considered anaphylaxis. So this typically happens within the first 10 minutes of administration. This would include things like hives, as well as it can be swelling of the tongue and throat, and it's still something that we watch out for. Anaphylaxis is very uncommon, and they are keeping track of that. The second thing is another category, which are much more rare, which include things like pericarditis, myocarditis, stroke. These really are based on individual risk factors. They are very, very low prevalence in healthy adults. And so this would be something where you would consider talking with your primary care provider before deciding which vaccine is appropriate for you based on your own set of risk factors.
Well, thank you. That was very helpful. So, Dr. Henry, when you get the vaccine, you talked about the adverse reaction that could show up within the first 10 minutes. So is that why they make you wait, and after you get the vaccine, you can't leave until that time period has lapsed?
Exactly. It's really a safety precaution. It doesn't happen very often, but it's something that is something we'd like to keep in mind. We are always watching for safety. And so that is why you would sit for that 10 minutes. It's very similar to many other procedures, injections, or medications that you would receive in a clinic setting.
So you described the differences between the vaccines that are available to us. So thank you. That was very helpful. Can a person choose which vaccine they get? So yes and no. So the first thing would be availability. Based on the availability in your area and with your providers will highly determine which vaccine you have access to. The second piece, like I said, you should make these decisions based upon A, the data that's out there, as well as B, your own personal set of risk factors. That's why that decision or that conversation with your primary health provider is a good decision before you select which one is correct for you. So another question that has been asked about vaccines, what are the ingredients that are in the vaccines you described for us?
Okay, so when it comes to ingredients, I would say it's easier to talk about what's not in them first. So the first thing I would say is that all three vaccines, regardless of which manufacturer you use, none of them contain any allergens or general allergens. So they're not made or produced with egg, peanut, or latex. And this really kind of lowers that risk across the board. The second thing is they don't contain any heavy metals. So none of these vaccines have any nickel, iron, any of the heavy metals. And the third thing that usually people refer to when they worry about ingredients in vaccines is the preservatives. None of these contain the general preservatives that were in the past, such as mercury or thimerosal. What I would say is if you want a definitive list of both the active as well as the inactive ingredients, I would recommend that you go either to the manufacturer websites or to the CDC directly. They are very transparent in the ingredients. I mean, I could definitely list them off for you, but I think that you would have more assurance by going on and doing the research yourself.
And I would assume that's also something, if you have a concern, you could certainly talk to your family physician about, correct?
Absolutely. Ingredients in everything that we consume nowadays is a hot topic, right? Whether it's processed foods, drinks that we drink, or medications that we consume. Your primary care provider is going to be a wealth of information across the board. And in particular, this pandemic area, vaccines are of particular interest, and a depth and wealth of knowledge we found there.
Perfect. Thank you. RJ, okay, you've had an opportunity to witness the impact of the pandemic during your clinicals. What do you feel is important for the campus community to know, and in particular for our students to know?
Yeah, so I don't have any letters behind my name or like the accolades.
Not yet.
Dr. Henry do. Yeah, not yet at least. But so I'm speaking mostly just out of experience. And I think there's really two things that it's really important for young people in our campus community to know. Like, first and foremost, I have sadly seen some really very sick young people in the ER. And then I've seen not so sick people with just the sniffles and a cough. I mean, I got a little sniffle right now. And a lot of these people, they're similar that they both have COVID-19. But the biggest difference between the severity of their illness is if they're vaccinated or not. And I think it's just great for young people to get vaccinated because it gives us our best chance of being the healthiest we can be, even if we do contract COVID-19. And that's just almost like a peace of mind to have as we go about our somewhat normal campus lifestyle that we're starting to get back to. And just getting these questions in the ER, I kind of get flashbacks to when quarantine first started. And I don't know about everybody else, but it was rough sometimes as a 20 to 22-year-old kid, 18-year-old kid. Your world kind of gets turned upside down. And so that's what I wanted to bring up secondly, as this pandemic continues to wear on. I think vaccines are our best tool of getting back to somewhat of a normal lifestyle safely. So I love being able to, after class, go down to the atrium, walk around, talk to everybody, seeing people face to face in class, going to sporting events, going to bowling nights, hanging out with friends on the weekends. The vaccines are what allow us to do this as safely as possible. There's much less risk, and just the health aspect is just much stronger if you're able to do that with a vaccinated community.
Thank you, RJ. Dr. Jung, when would someone want to consider getting a booster, and should they get the same brand of booster as they do their initial vaccine?
Based on the data generated by the many different researchers out there, the brand of the booster, it doesn't really matter at this point. And so J&J, their new data actually shows that their own J&J vaccine is also about 70% effect. The vaccine efficacy is established with a booster dose as well. So it is always recommended for the people who got the Moderna and the Pfizer is recommended to get within after 6 months, you should consider having a booster. And the J&J, because of the one data set that was generated by New York City, it looks like it started to declining from the 2 months, but it's not for every individual in that way. But so it is recommended for just to be in a safe side. If you are having a 2 months after having a J&J, you should consider get the boosters after that. But the recent data actually shows that it also lasts for 6 months to the majority of the population. So it is important for, if you are reaching up to the 6 months after you get the primary series of the vaccinations, you should consider having a booster of any the brands that's available in the United States.
Great, thank you. Dr. Henry, let's talk about antibodies. If someone has had COVID and then recovered, do they still need to get the COVID vaccine if they haven't gotten it yet?
So what I would say is the current data suggests that yes, they still need to get the vaccination. Dr. Jung had talked on this briefly at the beginning about the various types of antibodies, the difference between binding and neutralizing. And over time, all of these antibodies begin to wane, whether you've had it naturally or via vaccine. Vaccine, however, boosts the antibodies and gives you a more complex set of antibody protection. And so currently the recommendation is that yes, you need vaccine even if you've had previous exposure and or infection from COVID-19.
Thank you. Okay, RJ, we're coming up on and probably in now, because I'm not a medical professional, but the flu season. Should we still get our flu shot even though we have the COVID vaccine? And is there a waiting period between getting the flu shot and the vaccine, or getting the vaccine and the flu shot?
Yeah, absolutely. So flu season is definitely still here and around. It's definitely more mild as people practice actually pretty good, like safety protocols as far as like washing their hands and stuff, but it's still around. And trust me, we have had some cases here in Sioux City and people still feel just as cruddy. But absolutely, you can still get vaccinated for both COVID-19 and the flu. And then as far as when you get your vaccines, that's really personal preference. And again, talking with your primary care provider, I know I work with a couple of physicians that got their COVID vaccine and their influenza vaccine on the same day, and they didn't experience any terrible side effects. Their only piece of advice when I kind of was asking them about it, they said just get them in opposite arms. Get COVID in one arm and influenza in the other, just because you don't want to have a double sore arm from 2 injections. But yeah, absolutely. It's great practice, great advice to get vaccinated for both COVID-19 and influenza, especially this time of year.
And I'm going to add a follow-up question. What's the latest date you should really get your flu vaccine, your flu shot?
Oh, I mean, I'm not going to lie. I'm not 100% sure. It's really never too late. A lot of people do have that kind of mentality of like, oh, it's December, flu season's already started, I don't need it. But you can absolutely still get vaccinated for the influenza right now. And like, you will definitely be thankful that especially if you don't get it later in the year.
So maybe Dr. Henry or Dr. Jung, do you know what's the latest date someone can get their flu shot?
So typically we see that second spike in the months of February to March. And so we often recommend through the entire winter and fall season that you can still get it. So in latest, February, March is still recommended.
And what about for those people who are traveling? And this is just kind of a general question for all of you. For people who are traveling, is it recommended that you go ahead and get the number one, the COVID vaccine if you don't have it yet, and number two, the flu vaccine?
I think it's a great idea to have both vaccines administered, even though you're traveling around, I think. And luckily, and you can get those vaccinations in many different places. And really, for the flu, a lot of places offer for free, and or with a very small amount of money. So I think and COVID vaccine is if you are in somewhere, if you are registered and you go and just get it administered. So I think it's a very good idea to have it. And earlier this year, actually, there is some research done about flu is actually making this disease process of COVID worse. There were research has been done about it. So it is very important to have both vaccination done.
And Dr. Henry, I'm going to ask you this. If let's say I'm traveling for Christmas here pretty soon, or let's say I'm traveling tomorrow, is it safe for me to get my COVID vaccine today and or my flu vaccine today and travel tomorrow?
Yes, it's safe to get it now sooner rather than later. It does take a few weeks to get immune response as well as coverage. However, the sooner you have it, the more well protected you as well as anyone you come in contact is.
Great, thank you. RJ, where are some convenient locations that someone can get not only the COVID vaccine, but also the flu shot?
Yeah, absolutely. That's actually one of my favorite questions we get at the ED a lot is people will just, I don't know if they're telling the truth or not, like, oh, we didn't know where to go. But it's actually super convenient. As far as I know, everywhere here in Sioux City is free of charge. So everywhere you can think of, so like your normal like Walgreens and Hy-Vee, they're available every day, especially during the week. But then even like local pharmacies, so like Drilling Pharmacy is one that gets brought up a lot. They're offering vaccines. Basically just walk in, they pull out a certain amount each day, and their goal is to administer as many of those as they can. And then, of course, we actually have done a great job of our charger clinics of the COVID vaccines, which I think is a great way. So there's definitely many convenient places out there to get it.
Dr. Anasara, I know that you're part of our clinic here on campus. Are there any particular things that students need to know or employees need to know if they want to get either the vaccine or the flu shot here on campus?
The one thing I would say is that we have limited availability, so you'll want to sign up early in order to reserve your spot. The second thing is that paperwork, if you fill it out in advance, it'll make the process go more smoothly just because it helps to eliminate. And the third thing would be that you need to wear your mask when you come to student health. Please make sure it's the same as any other clinic that you encounter, so keep that in mind.
And if I'm a student and I forget my mask, is one available for me there at the clinic?
Absolutely.
Okay. Very good. Dr. Jung, are the COVID vaccines safe?
My answer is yes. So the reason is this. So 70,000 people were tested and administered before it was publicly available last year. So no medicine in the world, when they are launching for publicly availability, no one has ever done that much of administrations. That means we have safety data that we could get in 10 years in a normal situation, but we got it in 10 months. So people believe that because it was so short, there is not much the safety data available, but that's not true. We have enough safety data available when you compare to the other vaccines that has been approved. I think it's 27, 28 vaccines against the viruses. I think this one has more safety data than the others. So that's one of the reasons. Second reason is that I had some questions about, mRNA vaccine. Would that be long-term effect would be they are going to messing with our DNA, our genes? I don't think that's possible because just like our body is compartmentalized, our cells are also compartmentalized as well. Once your nucleus is the place where you have your genomes on, mRNA is generated at the nucleus, but it is transported out of the nucleus, located in the cytoplasm, so they can go ahead and make a protein. So mRNA, once they are getting out, because there's a specific process to make that mRNA as a mRNA, there is not much way for them to go back to the nucleus to mess with the genome. So it is the technology that the company came up with, that mRNA, is they are putting that signature of the mRNA so they are not shuttling back to the nucleus. So that's scientifically just safe. They're not going to mess up with the genomes because of that. And also the main ingredient is basically it's a tiny, super tiny butter droplets. So they are that super tiny butter droplets. Inside they have spike protein ready mRNAs in there. So we have those kind of water droplets, the super tiny butter droplets everywhere in our body. So it is not going to do much of that harm to do it. And that's basic ingredients of the mRNA vaccine. So it's very safe. And for the Johnson & Johnson, it's an adenovirus that causes some sort of cold and also eye infections as well. But they are gutted version of the adenovirus vector. So they are also safe to be able to use. So scientifically it has been proven that's safe. And mRNA vaccine, that vehicle and that super tiny butter droplets has been researched for decades. So it's a new platform, but in a field it was not that new. Same as as a viral vector, adenovirus vector is still new kind of technology, but it has been studied for decades. So it is safe. Trust me, it's safe.
Speaking of trusting you, I wanted to mention earlier, it's my understanding, Dr. Jung, that you are trained as an infection biologist. Is that correct?
Yes, ma'am.
And we're on 20 years now?
Yeah, a little bit more than 20 years.
A little bit more. Yeah. So, I mean, obviously we heard about Dr. Henry's credentials in all of her letters, but I did want to point out your specific expertise in terms of infection biology. And we have absolutely relied on your expertise in planning for COVID over these last 20 some months. So just wanted our listeners to know that as well. Dr. Henry, if I think I might have COVID, what should I do?
Well, I would say the first thing is use standard precautions. So anytime you feel that you're ill, you should not be going to class. You should not be going to sports. If you have a fever, if you have a purulent cough, anything like that, you can contact the Charger Health, either by phone or email. From their initial screening questionnaires will take place, and that'll kind of determine your risk based on a variety of factors. And from there, we'll either defer to watchful waiting or directly to testing. That would kind of be the process from initially.
And where would I go for testing, and what is the cost?
So there are a variety of locations and partners that we use here within the Siouxland community. And that would be determined by the severity of your symptoms, as well as clinic availability of appointments. As far as cost, there is no cost associated with the COVID-19 screenings. That being said, many symptoms overlap. So strep throat, influenza, and COVID often present very similar, especially in the initial phases. For that reason, when you go somewhere for testing, one of the local clinics, you may also receive a strep or an influenza screening, and those can be billed either A, to your insurance, or B, if you don't have insurance, you are looking at possible bill for those services. So just for full transparency, there may be some associated with the other tests that are available.
And if I want to get a rapid test, which is a test that would give me results within a very short period of time, like 15, 20 minutes, are those available, and do those cost money?
Once again, it definitely depends on the organization that you're using. Those are widely available. I will say that the PCR are going to be more reliable. However, if a rapid is what you have available, that was an excellent option for you at that time. Once again, most insurances cover a wide variety of testing.
Very good. RJ. Oh, wait, sorry. We already talked about that. Convenient locations. What about at-home testing? Are those something that I can use to determine if I have COVID?
Yeah, as far as at-home testing, we have patients come in to the ER all the time. Some of them bring multiple that they took this, and this said positive, this said negative. So kind of like Dr. Henry was saying, there's definitely a certain amount of accuracy that comes with each test. I think there are definitely false positives, false negatives, and vice versa. But I think any positive test, you're feeling ill, I think you should take the precautions with that. See your PCP. If you get worse, go ahead and be seen at an urgent care or the ED. But at-home testing is reliable, especially for a peace of mind. If you're not feeling well, you're concerned about visiting somebody over the weekend, going home, and you need to know if you would have COVID-19, it would be contagious. These at-home tests are reliable in the fact that just to give you peace of mind as far as your illness.
So RJ, you mentioned two acronyms. I just want to make sure that our listeners know what they mean. PCP is primary care provider and ED is emergency department. Is that correct?
Yes.
Well, thank you to the three of you as our experts for sharing this helpful information. Dr. Jung and Dr. Henry, I can absolutely see why our students love you as professors, and we appreciate your leadership and sharing your talents with us today. And same thing, RJ, I can absolutely see why our students have chosen you to be their leader, and appreciate your perspective and knowledge as well. So wanted to talk just a little bit about the OSHA vaccine mandate just for our listeners. So Briar University is preparing for if and when the suspension of these requirements could possibly be lifted. We do know that if those requirements are lifted, and we are required to move ahead with this vaccine mandate, Briar does qualify, and we are required to comply as they are currently written, and it will impact all employees of Briar University, including students. But I did want to share that as of right now, we have not implemented our policy yet. The requirements are being reviewed by the federal court system here in the United States. There is a possibility we could have a decision as early as Friday of this week, although that is not likely. But again, we will provide you with updates in a very timely fashion as soon as those updates are available. In the meantime, we're asking, as always, over the course of these last almost 2 years, to please continue to protect yourself and those around you. And as always, rooted in our Catholic Franciscan values and mission, we each have a responsibility to care for ourselves and care for those around us as God's creation. So thank you to all of you, and be safe. Good luck with finals, and God bless you all. Thanks, everyone.
Thank you. Thank you.